So my name's Solveig Sansom and I'm the Senior Commissioning Manager for Older People and Older People's Mental Health. That includes things like the Better Care Fund and relationship with our National Health Service partners. It's also the care homes contract that we're working on at the moment, and it also includes things like the assistive technology strategy. We know that we've been providing too much care for too long to too many people for a long time, and everything we're doing now, we're continually asking ourselves is, how is what we're doing now promoting independence? So that means allowing people to stay in their own home for longer, with a minimal amount of support, recognising that some people need support but they don't necessarily need it forever. It can just be for a short amount of time to help them get over a crisis. And one of the things that we want to explore further to allow that is technology-enabled care or assistive technology. So some of the things that we know we can do, we are already using. So things like telehealth and alarms, telecare and alarms, we've used before, but we haven't really expanded it any further. And what we need to do is think about how do we embed that in other areas of care that we're providing. So if someone's receiving care at home, can we embed assistive technology in some way to reduce the hours of care that are needed in care at home? So for example, some people have night sitters that perhaps never actually need to do anything other than just make sure that person stays safe in their bed. If we could use some kind of an alarm that tells us if that person is wandering, rings an alarm, warns somebody who can come and make sure that they're okay, or simply just triggers a voice that says, "Mum, you shouldn't be up at this time, get back to bed." We know that that can be really effective, and we've seen that work in other areas. So that's something we want to explore. The challenge, of course, is whether we are willing to do that separately, because if we put that in and still have night sitters, then we really haven't taken full advantage of it, and it's not the best, most effective use of our resources. So we need to make sure that our staff and the families and the people we're caring for are comfortable with that. And so that's some work that we need to do, and the way we do that is by looking at what has worked elsewhere, look at some case studies and do some pilots and see how that works.